Hi there, I'm with a patient who's here for a 4-month follow-up. It's a corrective procedure. In a max size case where we harvested from one side to the other side from one of his previous surgeries of what had happened. That's the scar. This is going to continue to heal. You can see the difference of how it's going to heal. So here's what we did once again. Here's what he had in another clinic. So this is the line, and this is still completely unhealed. He's only at 4 months. Still part of the old scar. We went through that. The stitch line right here.